Hi, my name is Crystal Talercio, and I'm going to be doing a newborn assessment today. Patient's name is James Jones and was born 48 hours ago. So what I'm going to do is use hand sanitizer, hand hygiene first, and then I'm going to put on some gloves. The next thing I'm going to do is check the ID bands of the baby and mom and ask her to verbally tell me the name and date of birth of herself and the baby. I'm going to make sure that the ID bands match. I'm also going to check and make sure that the baby has the security tag on. And while the baby is sleeping or at rest, I am going to listen to the baby. I'm going to check first at the abdomen, and there is no retractions noted. There's no nasal grunting or nasal flaring noted as well. And what I'm going to do is I'm going to listen to the heart in all 5 locations, taking the pulse at the apical pulse for 1 minute. And I'm going to listen to all 5 locations with the heart, with the bell and the diaphragm. Listen. And no murmurs or clicks or rubs are noted. I'm also going to listen to the lungs, and I'm going to listen to the front and the sides, and I will do the back when I inspect the back. And I'm listening. And breath sounds are clear to auscultation. His respirations are 50, but they are irregular. Okay. And I'll cover the baby back up. I'm going to now inspect the head. I will take the cap off if there is a cap. And the head is round and symmetrical. There is no caput or cephalohematomas noted. I'm going to feel the scalp, and I can feel that the fontanelles, the anterior and posterior, are soft and firm. And I can feel that the sutures are palpable with a small space in between each. And I'll put the cap back on the head. Next, I'm going to check the face. It is symmetrical. The eyes are reactive to light. The pupils are reactive to light. And there is no drainage or infection noted. Also, they are symmetrical, and there's normal movement of the eyes. The nose is symmetrical to the face, and I will occlude one nair, and the baby can still breathe. I will occlude the other nair, and the baby is still able to breathe without difficulty. No nasal flaring or grunting noted. I'm going to check the mouth. The mouth is pink and moist. The tongue is also pink and moist, and there's no blue tint around the mouth. Next, I'm going to put my finger in the mouth, and I'm going to feel the hard and soft palates. They are both intact, and the baby does suck on my finger, and that is a positive suck reflex. I'm also going to touch the baby's cheek, and it's going to turn the face towards me, and that is a positive rooting reflex. The baby has full range of motion on his neck. There is no webbing or extra skin noted at the neck as well. Next, I'm going to remove the blanket. I'm going to keep the legs covered. I'm going to take the shirt off if there is a shirt on. I'm going to inspect the chest. The chest is symmetrical with 2 nipples noted. They are about 1.5 centimeters, and they are evenly spaced. Abdomen is pink, and there are no retractions noted. And the respirations are 50. And when I listened to the chest, the breath sounds were clear to auscultation in locations anterior and laterally. Heart sounds were heard at all 5 locations. S1 and S2 were heard with the bell and the diaphragm. No murmurs, rubs, or clicks were noted. The apical pulse was heard. It was 130 and it was regular for 1 minute. The chest rises and falls with each respiration. The umbilical cord has 3 vessels present. There is no discharge, redness, or dryness noted. There is no presence of a hernia. When you palpate the abdomen, there's no masses or hernias noted. The abdomen is symmetrical, and I'm going to listen to bowel sounds in all 4 quadrants. And bowel sounds were heard in all 4 quadrants. They were normal active. So now there is no distension or masses in the abdomen. So I'm going to put the shirt back on and cover baby back up so he stays warm. I am going to next move to the diaper area. And he is a male, so the penis does have a urinary meatus at the tip of the glans penis. The baby did have a circumcision. The area is red, but there is no discharge noted. The testes are palpable on each side of the scrotum, and there's a large pendulous scrotum with rugae. His stream is adequate with voiding. There are no uric acid crystals noted in the diaper, and has a patent anal opening. He's had 3 wet and 1 meconium diaper since birth. And I'm going to check his femoral pulses, and I'm going to check here and here, and they are strong at 2 out of 4 bilateral. His legs have good muscle tone. They are symmetrical. There's some slight flexion to the legs. The plantar crease is present on the bottom of each foot. There are 5 toes on each foot. No webbing noted between the toes. And if you push your finger under the toes, they will curl around you, and that's a palmar reflex. And if you take the foot and you go up the foot like that, the toe should fan out, and that is a positive Babinski reflex. Okay. We're going to turn to the back here. We're going to check that the gluteal folds at the back are symmetrical. And we are going to put the baby's diaper back on. We're going to check the back next. We're going to make sure that the spine is straight in inspection and palpation, and that there are no tufts of hair, or that there are any dimpling or Mongolian spots. And there is no spots noted. I'm going to take a listen to the back, to the lung sounds, and lungs are clear to auscultation in the back. Next, the baby should be moving around, so I'm going to cover him up, and the arms are going to check for 5 fingers on each hand. And I'm going to place my finger, and the baby should curl their fingers against my finger, and that's a palmar reflex. Palmar creases are noted on both hands, and there are slight flexion of the arms noted, good muscle tone, and symmetrical movements of the arms. There's no webbing between the fingers. What I'm going to do now is I'm going to feel for the brachial pulse. Okay. And they are strong at 0.2 out of 4 bilateral. I am going to check the clavicles, and they are intact and no crepitus noted. Okay. I'm going to cover the baby up, and there are no lesions, masses, birthmarks, rashes noted. The skin is warm and pink. There's no evidence of lanugo, vernix on the baby. So I'm going to cover the baby back up, and I'm going to give the baby to mom. I'm going to take my gloves off, and I'm going to do hand hygiene, and then I'm going to document my findings.